All right, this is our second thyroid example. This is a category 2, which is an autoimmune issue. This particular person also presented with hypothyroid issues, same kind of thing, has always tested, quote, my thyroid's always normal. As you look here, the functional levels are off. They're not far enough out to be medicated, but they are out of range to justify some functional level thyroid symptoms, weight gain, hair loss, dry cracked heels, things like that. So when we look at this, again, always looking at the TSH, there's more gasoline going to the engine, and that could be either that the car is going too slow or it's going fast and the pituitary gland is incorrect in its assumption that it should be increasing the speed of the thyroid. In this case, it's correct. These numbers are all trending downward, particularly the T4, but also the T3 uptake. Everything's going down. There's some other things going on with this thyroid pattern, but primary definitely is the autoimmune issue here at the bottom. These antibodies are very rarely tested for, but it is the most common cause of hypothyroidism, Hashimotos. Particularly, this person has the TPO antibodies and the TGB antibodies. TPO is the enzyme that kind of makes the factory work harder to produce more hormone. It sticks the iodine onto the TGB. The TGB is the foundation or the base of the protein that ends up being T3 and T4. Both of those are elevated, meaning this particular person's immune system is attacking both the enzyme and the protein. So that particular person's ability to produce thyroid hormone is going to be significantly impaired. They're kind of keeping up, but not really. So this again would justify some hypothyroid symptoms. Again, looking at the ebook would be kind of helpful. An autoimmune situation is much more, out of all the categories, it's much more difficult to treat. You kind of want to look at working with somebody one-on-one with this. The other 5 categories are not too bad. They're a lot more straightforward. In this particular situation, you're looking at balancing the immune system. You have an imbalance between your Th1 and your Th2 helper cells, and then you get a dominant Th2, Th17 autoimmune issue. Sometimes you can get real lucky and people talk about removing gluten in certain foods that might be triggering that issue. Again, I'd probably recommend working with somebody one-on-one because this is a much more complicated issue, somebody that knows what they're doing holistically and nutritionally.